Okay, let's get right into it. You've got a patient in front of you with a suspected allergy. Picking the right test? Well, that's one of the most important first steps you're going to take. It's a fundamental skill for your day-to-day practice, and you can bet it's a high-yield topic for your board exams. So today, we are going to break down the three big ones to give you a really clear, really practical guide. And just a quick but important note before we start, this whole clinical guide is credited to the fantastic work of Dr. Mohammed Al-Naji Mohammed. Okay, with that said, let's jump in. So, here's our plan for today. We'll kick things off with a quick overview, then we'll do a deep dive into the three main players, the skin prick test, the RAST blood test, and the skin patch test. And we'll wrap it all up with a comparative guide to help you make the right call in the clinic every single time. So, why does choosing the right test matter so much? Well, it's simple. Not all allergic reactions are created equal, and our tests aren't either. Getting this choice right from the get-go is honestly the key to a fast, accurate diagnosis and a solid management plan for your patient. First up is the one you're going to see and probably use the most, the skin prick test. You can think of it as the real workhorse of allergy diagnostics, and for good reason. It's our go-to first-line investigation for those immediate type hypersensitivity reactions. So how does it actually work? Well, it's an in vivo test, meaning we do it right there on the patient. We place these tiny little drops of different allergens on the skin, usually on their forearm or back, and then we make a tiny little prick through the drop. If the patient is allergic, their body freaks out a little, releasing histamine and creating this small, itchy, raised bump called a wheal. And that wheal, that's our positive result. And here is where this test really shines. It's fast. I mean, really fast. You put the drops on, you make the tiny prick, and you wait just 15 minutes. In a quarter of an hour, you've got your answers. You just can't beat that for efficiency in a busy clinic. And this slide really sums up why it's so popular. It's not just fast, it's also cheap and super easy to do. Plus, you can test for dozens of allergens all at once. And crucially, we always use controls. We use a drop of histamine to make sure the skin can react, that's our positive control, and a drop of saline to make sure it's not overreacting to just anything. It's the absolute go-to for things like food allergies and pollen. Okay, but what if a skin test just isn't an option? Maybe your patient has severe eczema all over, or they're on an antihistamine that they absolutely cannot stop. What do you do then? Well, that's where our next tool comes in, the RAST test. This is a blood test that gives us a number, a quantitative look at the allergic response. The RAST, which stands for radioallergy sorbent test, is all about measuring specific IgE antibodies in the blood. You see, when you're allergic to something, your body produces these specific IgE antibodies to fight it off. This test finds those antibodies and tells you exactly how many are floating around in the bloodstream. And the great thing about the RAST test is that its result isn't just a simple yes or no. Nope, you get a grade on a scale from 0 to 6. This gives you a really precise measurement of the allergic sensitivity, from totally negative at 0 all the way up to a very, very strong positive at 6. And that number can be incredibly helpful. So the key here is knowing when to use it. It works great for food allergies, pollen, even insect venom. But its most critical job, the reason you'll reach for it most often, is for patients who simply can't get a skin test. Think about that patient with widespread eczema where there's just no clear patch of skin, or the one who can't stop their antihistamines. In those situations, the RAS test is your lifesaver. All right, on to our third and final test, which is a bit more specialized. This is the skin patch test. Now, if the skin prick test is for immediate BAM reactions, this one is the gold standard for delayed reactions, specifically for contact dermatitis. So the entire purpose of patch testing is to find the culprit behind that itchy red rash that shows up a day or two after contact. We're not looking for pollen or food allergies here. We are hunting for common contact allergens, things like nickel in jewelry, fragrances in lotions, or preservatives in cosmetics. And the timeline is a whole different ballgame. On day 0, we apply a bunch of patches, usually 30 or 40 different allergens, onto the patient's back. Then, 2 days later, they come back to get the patches taken off. But we're not done yet. The final read doesn't happen until 2 days after that, at the 96-hour mark. We have to wait that long to give any delayed reactions a chance to actually show up. Okay, so we've looked at the big three one by one. Now for the most important part. Let's pull it all together. This is where we figure out how to make the right choice for the right patient. So let me ask you directly. A patient walks in. How do you decide which path to go down? Well, the answer really comes down to comparing their core features side by side. Think of this table as your clinical cheat sheet. Got a suspected food or pollen allergy? You're starting with the skin prick test. It's fast, it's cheap, but remember, they have to stop their antihistamines. If they can't do that, or if their skin is a mess from eczema, you pivot to the RAST blood test. And if you're suspecting a delayed reaction, like contact dermatitis, that is the one and only time you'll use the multi-day skin patch test. It's that simple. Honestly, if you only remember one thing from today, let it be this. For immediate allergies, you start with the skin prick test. The RAST blood test is your essential backup plan for when a skin test is off the table. That one decision point will guide you correctly almost every time. Okay, let's lock in these takeaways for your practice and for your exams. Number 1, skin prick is your fast, easy, first choice for food and environmental stuff. 2, RAST is your blood test backup, giving you that valuable quantitative data when skin testing is out. And 3, skin patch is the slow, specialized test, and it's only for contact dermatitis. Got it? And I'll leave you with one final thought to chew on. Getting the right diagnosis, that's step 1. But the real art of medicine is what comes next, right? So how can we use these specific results, that wheel size, that IgE number, that positive patch, to build truly personalized management plans and really empower our patients? That's something to think about.